Hello, welcome back. I am Lady T, and this is the Push Channel. And today, for our Touching Tuesday segment, I want to talk to you about mental health. Stay tuned. May has been Mental Health Awareness Month. So by being Mental Health Awareness Month, I wanted to spotlight and highlight mental health. And as a clinician myself, because I'm a registered nurse, so as a clinician, I know the importance of not only our physical health, that it's important for us to take care of ourselves physically, but it's also important that we are taking care of ourselves mentally as well. And one of the things we did as a community, in the Push community, we did a 7-day self-care challenge.
Yes.
So part of that self-care challenge is, pointing out to the ladies that it's important that we are putting ourselves first. It's not selfish to take care of ourselves. We're so busy taking care of others, but it's also important that we're taking care of ourselves first. So I just want to thank you, Bianca, for coming and agreeing to do this interview with us today. So I have Bianca Lee with us, and she is with Small Talk Counseling, and she's one of their clinicians over there. So before we get started, Bianca, can you tell us a little bit more about yourself professionally?
Yes. My name is Bianca, and I've been at Small Talk for the last 2 years. I've also worked in an inpatient setting, which would be your hospitals on the mental health units, at 2 different hospitals in the area. I've also done intensive outpatient, which would be your groups, those patients that come in for a half a day for groupings based on their needs. And then also in outpatient. So that would be the private practice that I currently work at, and also at a counseling center out in Ascension Parish.
Okay, that's awesome. So you have like all aspects of it, inpatient, outpatient. Can you tell us a little bit about what is mental health? When you hear people say mental health, what exactly is that if you had to define mental health?
Mental wealth. Okay, there it is.
I like that.
It's about, your wellness, right? Your overall, how do you feel? How do you think? And are you able to be your best self? And if you aren't able to be your best self, then maybe you have to do a little checkup, just like you would if you were going in for your physical wellness. So for mental health, it's what's connected to your mental wealth, but also your mental wellness.
Okay. Yes. So that is very important, our mental health. And like you said, that wellness, that's part of that wellness checkup, just like we do a yearly annual wellness checkup. Sometimes we have to do that as well with our mental health. Mm-hmm. And one of the things with everything that's gone on in the past year and a half is COVID. Right. And COVID has affected people a lot. I mean, there's been people who have lost things, loss of lifestyles, loss of financial loss, as well as some people have lost loved ones going through all this. Some people have found themselves in isolation, and as well as dealing with anxiety. As a result of COVID. What are some tools and things that you think, as we're getting ready to leave and go into this post-COVID world, that people can do and use to be able to function? Because like I said, I know some people are having anxiety even about stepping out again into their church or going, getting back to normal activities. So the new norm. So what would be some things that you would say they could do to help with anxiety, those that may be dealing with anxiety?
We always say deep breathing, right? So focusing on your breath, but also if that is not working, talking to someone, right? Like you said, many people are experiencing loss. Many people are experiencing different effects, both positive and negative, from COVID-19 or anything else that may be happening. Natural disasters that's been happening, floods, the hurricanes, with COVID, those things may be a little bit more permanent, like your house, your job, your car. So it may be talking to someone. Maybe it's a friend that you trust. Maybe it's your pastor. And then that next step of talking to a counselor to see if you need their assistance in any way as well.
Now, one of the things that that's good is you're saying, like, talking to your counselor. Mm-hmm. What are some of the signs and symptoms that you should look at in yourself as well as others to know that it may be time to seek outside help?
Mm-hmm. That's a good question. The signs in yourself or in others, you don't feel like yourself, right? You're not getting adequate sleep. You have change in appetite. Things that used to be fun aren't fun anymore. So you're losing interest in things. Or even just knowing that you're experiencing some major life stressor, right? Maybe you're getting married, maybe you're getting divorced, maybe you had a loss, a pet, many different things or effects of COVID. Maybe you've been watching the news and you've seen different violence or just different things that are affecting you, and you can tell that it's affecting you. That's the only thing you can think about. It ruminates. If you've become impulsive with how you interact with people, or even excessive substance use. So that can be alcohol, that can be cocaine, crack, anything, marijuana even, if you've seen yourself do an uptick in use in that way.
Okay, then those are times. And then, so those are times that you may need to start seeking counseling. If I've noticed this, say I've noticed this in someone, how do you approach that conversation that they may need to seek help?
Hey, Lady T, I've noticed, a change in your mood lately. And typically, you would be excited to do this with me. What, is there something going on? Do you want to talk about it? Have you talked about it with anyone? No. Okay. Well, here are some numbers you can call, right? There are numbers that you can contact anonymously if you just need to talk to someone. But if you do want to go and actually seek someone on a regular basis, they can connect you that way as well. So first thing would be to talk to them, right? You don't want to say, hey, you need to go get help. No, let's see what's going on. Let's see what may be triggering this. Maybe it is just a one-time thing and, you're fine. Or this is something that may prolong and you may need to get some professional help for.
So I like how you said, like, to have that conversation, but not be confrontational.
Correct.
Because then we build up a defense if someone's like pointing out, you need to go get help, or,
right.
And then one of the other things is, how do we, what do you find are some of the stigmas that keep people from seeking that counseling help? I know, like, the PUSH community, most of the people that follow this channel are Christians. And then part of that Christian, I'm walking on my faith. I don't need to, I'm going to talk to the Lord. I don't need to talk to anybody else.
Right.
How do we get past some of those things? And what are some of the stigmas that you see that keep people from getting that outside help?
Yes. I am also Christian, just so people know. God won't give you more than you can bear, right? Or if he brought you to it, he'll bring you through it. One of my favorite scriptures, actually, too much is given, much is required, right? So those alone could make it seem like, okay, only God in those moments, but it's not a true absolute. It's, yes, these things are true, but then and some, right? Many people think that medication will change you. You won't feel like yourself, which may be true in some instances, but that's when you converse with your primary care physician or the psychiatrist, if they do decide that medication is a part of that treatment, right? Crazy, right? Or straitjackets, thinking that everyone is going to be put in a straitjacket.
Yeah.
I have yet to work anywhere where they use straitjackets. So that is not commonplace. And that's what you see on TV. You know, you'll also see the sitting on the couch with a Caucasian male with glasses and a notepad. That's potential too. However, there are more people of color, specifically women of color, who are in these positions now and can relate more and do more than just talk therapy, right? So it's not just, you know, spill all your guts, you know, spill all your feelings. And that's also with, you know, what happens in this house stays in this house, right? Yes. And in many ways that can hurt more than it can help. You know, if someone is being abused or someone is experiencing something, or if you know more about your family history and what they've experienced either growing up or current, you know, that can help you better prepare for what may come in your future, or the need that you may have.
I like what you said about as far as like what's going on in the family and being transparent. I think that's important, to be transparent about what has happened in the past. I feel like so many people don't realize that mental health is, and I'll let you expound on this, but I know that it also can be something that is clinical, that is a chemical imbalance. And it is a trait that could be going on through the generations. But then sometimes we get so into that secretive, and to nobody knew that Big Mama was suffering with clinical depression.
Correct.
So just the importance of being transparent, right, and letting people know that this actually runs in our family. Can you talk a little bit more about clinical depression versus situational depression?
So when we say clinical, or when you're focusing on what can be passed down genetically, right? That means you're predisposed to this, and either your body is going to tap into it and accept it as what will be for you, what traits you will inherit, or depending on your surroundings, your environment, your nurture, if that will come into play, right? So when it comes to clinical depression, and correct me if I'm because with your terms, I want to make sure that I'm describing the right thing, is when you have the need for medication, when you have the need to have that intense therapy where you can't get out of the bed any day, nothing is helping. When you aren't sure what your pleasant events are, you still feel hopeless, you still feel alone, you still feel that nothing will ever change, right? And worthless. And there are levels to feeling depressed, right? There's, you know, your mild, if we go by the diagnostic manual, there's the mild, there's the moderate, and there's the severe, right? Severe is typically when the treatment plan includes medication, because you need that little assistance to get to feeling like yourself, to feeling your best self, to getting out of the bed, to functioning, right? Because it's all based on functioning. Whereas if you are grieving, right? If you're grieving, that would be your, what was the term you used for?
Situational.
Correct. Whereas, yes, you feel depressed in this moment, but it's not for a longer period of time, right? It's in this moment, I feel hopeless, but I see in the future that it's going to get better, right? And that's where the difference between what treatment you get, right? It's individualized. Everyone experiences everything differently. What may cause me to feel depressed may not cause you to feel depressed, but it's the same experience, right? So I would say the difference is the treatment for the two.
Okay, well, that's good to know. And then when you're getting, I like what you said, when it's to the point, I guess, where you're really not functional, you're getting to the point where you're not functional, then you need additional assistance where counseling may not be enough. In addition to counseling, you may need medication. One of the things I wanted to ask you too, what is the difference? You can someone say that you're trying to convince them to go to counseling, or they'd be like, well, I talk to my girlfriend. That's my counselor. Like, what would you say to convince someone to seek professional counseling over family counseling or your friend?
So friends, even as much as we want to be, we are not totally unbiased. We do not know the full story. We don't know. We can give advice. We can encourage, but to truly get a neutral, unbiased opinion, you have to go to someone who knows nothing, right?
Yes.
And sometimes they can present what you say back to you in a way that may make better sense than your friend or your girlfriend or, boyfriend, your spouse. And that's not to say don't talk to them. You need to have that support. You need to maintain that support system for your mental wellness, but also tapping into a professional. They can see if there's anything underlining, or they can connect more dots. There's this visual that circulates on social media that has a therapist talking to a client, and everything that the client is saying is like in a bubble, and then the therapist is like pulling out certain things. And what we can do is we can find those patterns. We can share, what we hear from the perspective of you, right? Because we still only know what you're sharing, but we still have multiple perspectives in our mind that we can think of as well to best assist with whatever situation is going on.
Okay. That's good. That's good. Now, as far as what are some suggestions you have outside of me seeking counseling? Maybe I'm not at that point where I need to seek counseling, just to maintain that self-care. What are some things that you would recommend for good mental health?
Continue talking to people, someone you trust. So a friend, a family member, a pastor. Continue. I know you said, the population that watches, continue reading your Bible, praying, tapping into, and I know I keep saying tapping into, but your spiritual wellness, right? Your spiritual wellness is directly correlated with your mental wellness. And so maintaining that interest in, okay, I want to be at peace, and acknowledging what are those needs that you have? What are those things that you're praying to God for? Like you said, the 7-day self-care challenge, loving yourself and knowing that, if you're doing things that make you feel happy and surrounding yourself with people that make you feel happy, that has a positive effect on your mental wellness.
I definitely believe in that. I definitely believe in sticking and doing things that make you happy. And sometimes we have to get rid of people or circumstances that's bringing you down.
Correct.
So knowing and staying in tune with your mental health, I think is very important. Thank you. I want to thank you for your time, for sitting down, taking out your busy schedule to talk to us about the importance of mental health. I definitely believe in therapy and medication if we need it, that it's okay. And also talking to us about those stigmas, that it's not that somebody's about to go take you and put you in a straitjacket.
Right.
It's about your mental being, not just physical, but your mental health as well, to be your best self. Correct. So, I will put in the links below. I know you've sent me some resources that are important for people, so I'm going to put those down in the description of this video. And then if there any way, if they needed to contact your group, I'll put the link to the website to Small Talk Counseling down there as well. Is there anything else you would like to say before we close out?
Thank you for this opportunity. As a therapist with a therapist, I understand, the search for a good therapist and someone that, is a good fit, but also having that spiritual element that I need as well. Hopefully, if anyone who needs it is watching, definitely do it. Making that first step, with making that first call, with making that first text. There are many resources out there. And like you said, our information will be in the description. So you can email us, call us. We also have we're virtual right now, but we also have virtual book club and a virtual group as well. So definitely reach out to us.
Okay, a virtual book club. Okay, I'll have to check that out.
Yes. And both will be ongoing and seasonal. So yes.
Okay. All right. Well, thank you for your time.